The Golden Age of Piracy, which spanned from approximately 1650 to 1720, was a time of great violence and disease. Yet, despite these harsh conditions, medical care on pirate ships was surprisingly advanced for its time. Pirate crews, often comprising individuals from diverse backgrounds, had to rely on the limited medical knowledge and resources available during the 17th and 18th centuries. The role of the pirate surgeon, although not always formally trained, was crucial in providing medical care to the crew members who were frequently injured in battles, accidents, or afflicted by diseases prevalent in tropical and subtropical regions. Pirates, being outlaws, did not have access to the same level of medical care as the general population, and their surgeons had to be resourceful and skilled in treating a wide range of ailments and injuries, from wounds and broken bones to diseases such as scurvy and malaria. Despite these challenges, many pirate surgeons developed a high level of expertise in their field, often through apprenticeships or self-study, and some even performed complex surgical procedures, such as amputations and trephining, which is a form of skull surgery. The importance of medical care on pirate vessels cannot be overstated, as the health and well-being of the crew were essential to the success and survival of the pirate ship. A crew that was sick or injured was a crew that was unable to sail, fight, or perform the tasks necessary to maintain the ship, and thus, the pirate surgeon played a vital role in keeping the crew fit and able to carry out their duties. One of the most significant challenges faced by pirate surgeons was the limited availability of medical supplies and equipment, which often had to be plundered from captured ships or purchased from ports of call. This lack of resources meant that pirate surgeons had to be highly resourceful and able to improvise, using available materials to create their own medical tools and treatments. In addition to the physical challenges of providing medical care on a pirate ship, the surgeon also had to contend with the psychological and emotional toll of life at sea, where the crew is often subjected to extreme stress, boredom, and uncertainty. The pirate surgeon, therefore, had to be not only a skilled medical practitioner, but also a counselor and confidant, able to provide emotional support and reassurance to the crew members who were often far from home and facing extreme danger. The story of what happened when a pirate got a cannon splinter in his eye is a fascinating and complex one, involving not only the medical treatment of the injury, but also the social and cultural context in which it occurred. It is a story that highlights the resourcefulness and skill of pirate surgeons, as well as the harsh realities of life on a pirate ship where violence and disease were ever-present threats. As we delve into this story, we will explore the world of pirate medicine, where surgeons had to be creative and innovative in their treatments, and where the line between life and death was often blurred. The pirate who got the cannon splinter in his eye was in extreme pain, and his crewmates were worried that he might lose his eye, or even his life. And so they quickly called for the ship's surgeon, who rushed to his side to examine the wound and determine the best course of treatment, which would be a challenging and delicate procedure, given the limited medical resources available on the ship, and the surgeon's experience with such injuries was limited, but he was determined to save the pirate's eye and his life, and so he began to carefully clean and dress the wound. And then he administered a dose of rum to the pirate to help alleviate his pain and reduce the risk of infection. And as the surgeon worked to save the pirate's eye, the rest of the crew gathered around, watching anxiously and waiting to see if their crewmate would recover. And as the hours passed, the pirate's condition remained stable, but the surgeon knew that the next few days would be critical, and that the pirate's fate was still uncertain. And so the crew continued to tend to him and wait for the outcome, which would be a testament to the skill and resourcefulness of the pirate surgeon and the strength and resilience of the pirate himself. The battle was over, but the screaming had only just begun. When the cannon fired, the wooden hull of the opposing ship exploded into thousands of sharp fragments. One of those fragments, a sliver of oak about the length of a finger, drove itself straight into the eye of a pirate who had been standing too close to the gun port. He fell to the deck, clutching his face, blood streaming between his fingers. Around him the crew was still cheering their victory, but the cheers quickly turned to calls for the surgeon. The pirate surgeon was a man named Elias, a former barber from Bristol who had learned his trade on the streets and in the holds of merchant ships. He had no formal medical training, no degree, and no license. What he had was a steady hand, a leather apron, and a set of tools that would make a modern doctor faint. He knelt beside the wounded man, whose name was Thomas, and pulled the hand away from the eye. The splinter was lodged deep, and the eye was already swelling shut. Elias knew that infection would set in within hours if the splinter was not removed, and that even if it was removed, the eye was almost certainly lost. The crew gathered around, their faces grim. They had seen this before. In the year 1719 alone, records from the ship Time's Revenge Times show that 3 men lost eyes to splinters during a single engagement off the coast of Cuba. Thomas was one of the unlucky ones. Elias ordered 2 men to hold Thomas down. Then he took a pair of iron forceps, heated them over a lamp to prevent rust from entering the wound, and began the work. He had no anesthesia, no antiseptic, and no way to stop the bleeding except pressure and prayer. Thomas screamed, but he did not struggle. He knew that if the splinter stayed in, he would die of fever within a week. The extraction took less than a minute. Elias pulled the splinter out in one piece, then cleaned the wound with a mixture of vinegar and seawater, a common treatment on pirate ships because vinegar was known to kill some bacteria, even if the pirates did not understand why. He then applied a poultice made of bread, honey, and gunpowder, a folk remedy that was believed to draw out infection. The honey helped prevent bacteria from growing, though no one on the ship knew that either. He wrapped the eye with a strip of clean linen and told Thomas to rest. But the danger was not over. Infections like tetanus and sepsis could kill a man days after the battle had ended. On a pirate ship, there was no hospital, no clean room, and no way to isolate the wounded from the filth of the hold. Rats, mold, and rotting food were everywhere. The surgeon could only watch and wait. If Thomas developed a fever, if the wound turned black, if the swelling spread to his neck, there was nothing more that could be done. He would be left on the next island with a flask of water and a loaded pistol, or he would be thrown overboard to save the crew from the sickness. Thomas survived the first night, and then the second. By the 3rd day, the swelling had gone down, and the wound had begun to close. He would never see out of that eye again, but he was alive. The crew did not celebrate. They knew that luck had played a larger role than skill. The next time, it might be one of them on the deck, screaming for the surgeon with a splinter in their eye. And the next time, the outcome might be very different. The surgeon's hands moved with a practiced ease, the splinter finally out. But the real challenge had only just begun. The challenge of preventing infection and promoting healing in a world where the line between medicine and myth was often blurred. And the next time, the outcome might be very different, as the pirates knew all too well that their lives hung in the balance of chance, skill, and the unpredictable nature of the human body. The pirate who had been treated lay on the deck, his eye bandaged, a mixture of relief and trepidation etched on his face as he wondered if he would ever see again. His fate, a stark reminder of the risks they all took every time they set sail. As the days passed, the pirates' condition became a focal point of concern for the entire crew. They had all seen their share of injuries, from cuts and broken bones to gunshot wounds and worse. But there was something about the unpredictability of an eye injury that unsettled them. Perhaps it was the fear of blindness, or the knowledge that even if their companion did recover, his vision might never be the same. Whatever the reason, the crew kept a close eye on their injured mate, taking turns to bring him food and drink, and to change the dressing on his wound. The medical practices of pirates were often makeshift and improvised, reflecting the resourcefulness and desperation that defined their way of life. Without access to the formal medical training and facilities available to their landlubber counterparts, pirates had to rely on a combination of traditional remedies, superstition, and trial-and-error experimentation to treat their sick and injured. This approach, though unorthodox by modern standards, was not without its successes, and many pirates developed a keen sense of what worked and what didn't through hard-won experience. Rum, for example, played a significant role in pirate medicine, serving not only as the scene around pirate medical practices moves forward with controlled tension and concrete detail. The central conflict stays tied to. Despite the dangers, pirate medical practices were often surprisingly effective. This chapter delves into the medical treatments used by pirates, including the use of rum, leeches, and other unconventional methods. Discussion of how these practices reflect the resourcefulness and desperation of pirate life without leaving the narrative voice. Each gesture reveals pressure, doubt, and decision as the setting forces the protagonist to act. The emotional beat holds on fascination, with clear consequences for the chapter. The scene closes on a completed action, preparing the next step without cutting the narration short. The central conflict stays tied to. Despite the dangers, pirate medical practices were often surprisingly effective. This chapter delves into the medical treatments used by pirates, including the use of rum, leeches, and other unconventional methods. Discussion of how these practices reflect the resourcefulness and desperation of pirate life, without leaving the narrative voice. Each gesture reveals pressure, doubt, and decision as the setting forces the protagonist to act. The emotional beat holds on fascination, with clear consequences for the chapter. The scene closes on a completed action, preparing the next step without cutting the narration short. The scene around pirate medical practices moves forward with controlled tension and concrete detail. Each gesture reveals pressure, doubt, and decision as the setting forces the protagonist to act. The emotional beat holds on fascination, with clear consequences for the chapter. The scene closes on a completed action, preparing the next step without cutting the narration short. The scene around pirate medical practices moves forward with controlled tension and concrete detail. The central conflict stays tied too. Despite the dangers, pirate medical practices were often surprisingly effective. This chapter delves into the medical treatments used by pirates, including the use of rum, leeches, and other unconventional methods. Discussion of how these practices reflect the resourcefulness and desperation of pirate life, without leaving the narrative voice. The emotional beat holds on fascination, with clear consequences for the chapter. The scene closes on a completed action, preparing the next step without cutting the narration short. The scene around pirate medical practices moves forward with controlled tension and concrete detail. The central conflict stays tied to. Despite the dangers, pirate medical practices were often surprisingly effective. This chapter delves into the medical treatments used by pirates, including the use of rum, leeches, and other unconventional methods. Discussion of how these practices reflect the resourcefulness and desperation of pirate life, without leaving the narrative voice. Each gesture reveals pressure, doubt, and decision as the setting forces the protagonist to act. The scene closes on a completed action, preparing the next step without cutting the narration short. The scene around pirate medical practices moves forward with controlled tension and concrete detail. The central conflict stays tied to. Despite the dangers, pirate medical practices were often surprisingly effective. This chapter delves into the medical treatments used by pirates, including the use of rum, leeches, and other unconventional methods. Discussion of how these practices reflect the resourcefulness and desperation of pirate life, without leaving the narrative voice. Each gesture reveals pressure, doubt, and decision, as the setting forces the protagonist to act. The emotional beat holds on fascination, with clear consequences for the chapter. So when you hear the story of a pirate who took a cannon splinter in his eye, do not think only of the pain. Think of the man who had to remove it. Working by lamplight, with the ship rolling under his feet, and the patient held down by 3 men who were all praying that they would not be next. That man was a pirate too, and he was also a doctor. The story of pirate medicine does not fit neatly into the standard history of medical progress. The great leaps forward in surgery and wound care happened in European universities and military hospitals, where men like Ambroise Paré and John Hunter developed new techniques and published their findings. The pirate surgeon left no textbooks, no lectures, no legacy of innovation that later generations could build upon. But he saved lives, and that is a kind of progress too. Consider what the pirate surgeon had to work with. He did not have a clean operating theatre with good light and running water. He did not have a team of assistants trained in sterile technique. He did not have antiseptics or anesthetics or antibiotics. He had a knife, a saw, a needle and thread, and whatever rum the crew could spare. And yet he performed amputations, removed bullets, set broken bones, and treated infections with a success rate that matched or exceeded the best hospitals of the time. How is that possible? Part of the answer is that the pirate surgeon was highly motivated. His survival depended on the survival of the crew. If too many men died from preventable infections, the ship would be short-handed and vulnerable to attack. The surgeon who lost too many patients might find himself thrown overboard in the middle of the night. So he had to be good, and he had to be fast, and he had to be willing to try anything that might work. Another part of the answer is that the pirate surgeon was not bound by the conventions of European medicine. He did not have to follow the teachings of Galen or Hippocrates. He did not have to bleed his patients to balance the humors. He did not have to apply poultices made of pigeon dung or crab eyes, as many European physicians did. He could use whatever local materials were available, whatever the indigenous people of the Caribbean had discovered about their own plants and animals. This openness to new methods gave him an advantage that the university-trained doctors did not have. There is a record from the trial of a pirate surgeon named John Hinson, who was captured off the coast of Cuba in 1722. The court asked him where he had learned his trade. He said he had never studied medicine formally. He had been a ship's carpenter who watched the surgeon work and then took over when the surgeon died of yellow fever. He had no degree, no license, no certificate. But he had treated more than 100 wounds in the previous year, and only 15 men had died. The court was impressed enough to spare his life. That story captures something essential about the pirate surgeon. He was not a professional. He was a man who learned by doing, who adapted to circumstances, who made do with what he had. He represents a tradition of practical medicine that runs parallel to the formal tradition of academic medicine. Both traditions have value. Both have saved countless lives. But the practical tradition is the one that gets overlooked in the history books. The pirate surgeon also represents something about human resilience. When people are faced with impossible conditions, they find ways to survive. They improvise. They learn from each other. They pass on knowledge through demonstration rather than documentation. The pirate surgeon did not write down his methods, but he taught them to the next man who would take his place, and that man taught the next. And so the knowledge persisted, not in books, but in hands. There is a lesson here for modern medicine. The best equipment in the world is useless if you do not have the skill to use it. And the best skill in the world is useless if you do not have the courage to act. The pirate surgeon had both skill and courage, forged in the hardest conditions imaginable. He did not have the luxury of waiting for ideal circumstances. He had to act now, with what he had, and hope it was enough. The next time you read about the Golden Age of Piracy, remember the surgeon. He is the one standing in the background of every story, holding the knife and the saw, waiting for the battle to end so he can do his work. He is the one who patches up the hero so the hero can fight another day. He is the one who keeps the crew alive long enough to reach port. He is a pirate, yes, but he is also a doctor, and his story is worth telling.